All right. Hello, everyone. This is Chadi Alraies from Denver, Colorado, CVI 2022. With me is Dr. Timir Paul, and he is talking about a very non-interventional but very important topic related to PAD, the role of PCSK9 in patients with PAD. Timir, always nice to see you.
Nice to see you.
So tell us about the role of PCSK9, like literature, trials, and if we can use it or not.
Yeah. So first of all, that in PAD patients, there is no specific head-to-head randomized trials or large randomized trials, but we have two trials, landmark trials for cardiovascular outcomes in all comers, like 4-year trial and also Odyssey outcome trials.
Odyssey outcome.
So Odyssey outcome trials have around 18,000 patients, more than 18,000 patients, and they looked at the cardiovascular outcomes in patients who are on statin therapy, high dose of statin therapy, and with ezetimibe. If their LDL is still low, it shows that adding a PCSK9 inhibitor significantly decreased the cardiovascular outcomes for primary safety outcomes.
So regardless, even if the LDL low, PCSK9 has this additive benefit.
Yeah, but if that benefit is if their LDL is more than 70, if it remains more than 70 on statin therapy and ezetimibe.
Okay.
And then 4-year trial have around 28,000 patients, and this exactly shows the similar outcomes. The absolute risk reduction is 1.5% in 3 years compared to placebo. So, but can we use this data to PAD patients? Mm-hmm. So now both these trials did their subgroup analysis, like pre-specified analysis. It's not really subgroup pre-specified analysis. So Odyssey outcome trials, they looked at the PAD outcomes and BT outcomes in patients with ACS, all comers, and they showed that if we add the PCSK inhibitor, their limb events, like the PAD events, like acute limb ischemia, repeated vascularization, amputation, it's got significantly low.
Significant.
Compared to placebo. And then...
Compared to placebo or statin and...
exactly. Yeah. Compared to placebo means,
other
comparator.
Comparator.
And then they also looked at some trials. They also looked at in patients with polyvascular disease. Like if you have a 3 vessels involvement of atherosclerosis disease, their absolute risk reduction is 19%. 19% to decrease the PAD events. So it's a significant reduction of PAD events.
Absolute 19%.
Absolute 19%.
Not even relative.
Yeah, I never heard of that.
That's a big number, double digits.
Number. So those are the subgroup analysis of the Odyssey outcome.
Yeah.
Now the 4-year trial is specifically looked at patients with PAD. So there are more than 3,600 patients in a PAD group. They all have PAD, established PAD. If they have a symptomatic claudication with a BI less than 0.85, if they have a amputation previously, or if they have any kind of revascularization, all those patients, they looked both cardiovascular outcomes and also PAD outcomes. So PAD outcomes, again, the acute limb ischemia, repeated vascularization, and amputation, major amputation. So, and this study is very solid, meaning that it shows that the MACE or male outcomes in all comers or in the PAD patients, the absolute risk reduction is 4.1%, and number needed treatment is around 24. So this is one of the lowest number needed treatment I've ever seen. So all this data we can extrapolate and use for the PAD patients.
Right. So this is in patients. So basically, somebody with PAD, established PAD, had multiple intervention. So would you recommend now routinely to start them on PCSK9 if their LDL still 70 or above?
Yeah, absolutely. So if they are on statin, or if they are maximum tolerated statin dose or the high intensity statin dose, and you give the ezetimibe or ezetimibe, because one trial everybody got ezetimibe, the Odyssey outcome trials, but ezetimibe, the 4-year trial, some patients got ezetimibe, some patients not. So both are class 2A based on the current guidelines, either ezetimibe or PCSK9 inhibitors. So basically, if their LDL is above 70, we should
start with these patients. And less PAD also is we know from previous trials is if you have less PAD events, you have less CAD enough.
Yes.
events, and
Yes.
already Odyssey and Frontier
Yeah.
already have been shown that in CAD space.
Right. And both the trials also showed that not only the PAD patients, if you separately PAD and non-PAD patients, they also get significant reduction of primary outcomes, both limbs and cardiovascular outcomes. Not that extent, but it got significant reductions.
So still,
It's-
less is more, less is better for the LDL, and the only thing that bring it down is, as we know, is PCSK9.
Right. And 4-year trial also showed that, as you mentioned, lower is better. And they went as low as less than 10 LDL. And so interestingly, the Odyssey outcome trial, they showed that apolipoprotein is the predictor for limb events in PAD patients, not
the
the
LDL.
LDL. Not the LDL. Very interesting. I didn't know until I present today in looking and in depth.
Do you know if it was apolipoprotein A or B?
Apolipoprotein A.
A, okay.
Lipoprotein A, not the apo. Lipoprotein A.
Wow. Wow. So this is another kind of more specific marker
More specific.
in this cohort of patients.
Right.
Well, very interesting, Timir. Thank you so much for the insight
Oh.
and very important intervention, not invasive intervention in patients with PAD. Thank you for watching this video. Watch the others on CVI YouTube channel. This is Chadi Alraies from Denver, Colorado. Timir,
Thank you.
Thank you for being with us.
Thank you for
Thank you.
inviting me.